Okay, we are live on Facebook and we are here today doing a presentation of something that's very important. It's something very near and dear to my heart. It's something that for the past couple of years here at Westwood for All Ages, we've been looking at and sharing with people how to, for lack of a better phrase, how to die well. And advanced planning is really important. You know, we're in a day and age right now where we're being acutely aware of the need to have plans in place, to be able to share our wishes with our loved ones of those things that matter to us, to appoint people to be representatives for us if we're not able to speak for ourselves during unfortunate circumstances. So as it turns out, we had planned to do this live last month. We were going to be doing a workshop called 5 Wishes. We've done it in the past and it was hugely successful. But events being what they are, we obviously had to cancel that workshop. But I'm so happy that Shana Siegel, who is an attorney who was going to be one of our presenters for that workshop, reached out to me and said, you know, we can still present this information, Lisa. We might just need to condense it a little bit, do it in a smaller format. And I thought that's a great idea. We'll do it here on Zoom. We'll try to live stream it and get it out to as many people as possible. And you might be watching this on a recording or you might be watching this live. If you're watching it live on Facebook, you can type in any questions that we can share with Shana later. But she's going to be doing the bulk of this presentation today. And I just want to share with you one resource that you can go to if you're looking for a document that you can work on to express your end-of-life wishes, and that's called 5wishes.org. And they have an online version of a form that you can download and complete for yourself. And again, it's 5 wishes, and not the number 5, you just spell it out, F-I-V-E, wishes.org. So I would encourage you to go and look at that site. There are other resources, and we'll be happy to share those as well. We'll probably put them on our Facebook page and our website, to also give you even more tools and resources for end-of-life planning. I'm gonna pass it over here to Shana in a second. Am I saying that right, Shana or Shana?
Shana.
Shana, okay. So Shana Siegel is an attorney who practices elder law and estate planning with Norris and McLaughlin Law Associates. And she's been in this field for many years, for more than 25 years. So she comes with tons of experience. She presented with us when we did a 5 Wishes workshop last May, and people were just so impressed and pleased with the information that she had to share because she makes it very accessible and very understandable to everybody. So with that, I'm gonna pass it over to you, Shana, and I'm gonna kind of bow out here. So I'm gonna give you the screen and the microphone in just a moment. There you go.
Terrific. Thank you so much, Lisa. I really appreciate this opportunity. This is one of the most important things, I think, in general, but particularly now to talk about in terms of, you know, making sure that our wishes are respected and known. And so I love this opportunity to share with the public. So I'm going to share my screen here. I've got some slides which maybe are helpful. Here we go. Okay. And we're going to start our slideshow. Okay, there we go. So we're talking about planning for a good life. And, you know, it's funny because it seems like we like to plan for just about everything else. I know right now people are thinking about how we plan for things like vacations and all the things that we're going to do once this is over. But people don't like to think about planning for healthcare decision making. And I think because people think of it in terms of death, and nobody likes to talk about that subject. But first of all, we're going to talk about why it's important to do that, why it's not just about death, and why it's really about maintaining control. And it really is a gift to your family members to be able to plan for these things, to share your wishes with them and give them the tools they need to be able to implement your wishes. So, all right, little humor here. Everybody's gonna face old age and disability. And unfortunately, we're seeing people who are facing these issues, healthcare decision-making issues, even outside of old age right now with this virus. So it's important to get ready. People often think about this as a loss of control, but really if I get one idea across, it's the idea that it is empowering. It is controlling your own story by sharing what your wishes are and giving your family members the tools to implement those. We're going to talk about these particular legal tools that are laid out here: healthcare proxy, instruction directive, also known as living will, DNR, and something called a post. Because unfortunately, if we don't make the decisions and we don't give our family members or our friends or whoever is acting for us the right to make these decisions, then somebody else is going to make those decisions. And unfortunately, not the people that we probably want to do that. So that's why this is so important. New Jersey has always been at the forefront in dealing with healthcare decision-making issues. We had the case of Karen and Quinlan back in 1975, and that was a landmark case that addressed patients' rights to make their own decisions, decide what was important to them at end of life. And now we have, just last year, just a few months ago, the Medical Aid in Dying Act, which allows competent individuals to choose how they want to die and to end their life with medication in certain scenarios. So, you know, these are all important things that New Jersey is leading in, so we want to take advantage of the rights that we have here in the state. In New Jersey, we have something called the Advanced Directive for Healthcare Act, and that is the right to do a healthcare proxy. This is a document where we would designate an individual or a number of individuals in order to be able to step in and make healthcare decisions if there came a point where we couldn't. The important thing to know is these documents only become activated if you are unable to make your own healthcare decisions or unable to communicate them. And that's when you would have someone, whether that is your spouse, your child, your best friend, be able to step in and make those decisions for us, hopefully knowing what our wishes would be. The document needs to be signed and dated. It needs to be notarized or have two witnesses. And by the way, right now we have a new electronic notary law. So if you are just getting around to doing these documents, certainly if you could get two witnesses, that would be wonderful. But if you are unable to do that, we can do notary remotely through the use of Zoom. So that's something that we can help you with. The person who you're appointing cannot be one of your witnesses. So if you're going to do it at home, you need to make sure that it's not the person who you're appointing is witnessing. And we find that often people have a number of these documents. Each time they go to a hospital, they may have drafted one of these. So you want to make sure that the latest one that you have is the one that reflects what your wishes are. So this document, a healthcare proxy, it's also known as a medical power of attorney. As I said, it appoints an individual to step into your shoes. And that person is going to be someone who does what you want them to do. They're not making their own decisions. They're making decisions based on what you have shared with them or what they know about your values and applying that to the situation at hand. You only can appoint one person at a time, but you can have a variety of people listed as successor agents. And you can also require them to consult others. But you want to make it clear who has that priority so you don't set up a situation where you have a disagreement and then you have a challenge. You shouldn't be appointing your primary doctor, administrator, or employee of a facility where you're working unless they're also an immediate family member. And, you know, we often have situations where people are looking to who can I appoint if you don't have a family member or a friend that's available. And we'll often suggest that maybe there is somebody in your community, a member of clergy, someone in an organization or friend that you might be able to appoint. As I said, the proxy needs to respect your wishes. So if you have done an instruction directive or a living will, which we're going to talk about in a minute, and your proxy does something that's inconsistent with that document, then that would be subject to challenge. So we want to make sure that that individual who you're appointing knows what your wishes are. It's also really important when you think about who this person is, that they are going to respect your wishes, that they're going to be able to make a decision. They're not going to get too emotional about it. Of course, you know, we're all emotional when we're facing these challenges, but they're not going to be frozen with the emotion. And that they are going to do things that are consistent with what you want, and that they're going to be strong and be able to talk with a medical professional and advocate for your wishes. So, you know, just keeping that in mind in terms of thinking about who you might want to appoint. Okay, so when we talk about an instruction directive or a living will, and often these are in the same document as the designation of the agent, the healthcare proxy. So if you're looking at, for instance, the 5 wishes document, it includes both pieces, the instructions as well as the appointment of agent. But sometimes the documents are kept separate, and you have one for each. I have found in my practice and in speaking with healthcare professionals that the instructions are most helpful when they are kept focused on functional limitations. You know, too often people have these documents and they don't really understand what they're applying to. They talk about things like persistent vegetative state, or brain death, which, you know, some people might not really understand. But if you focus on what's important to you in terms of, is it important to me that I can understand my loved ones, that I can communicate with my loved ones, that I can get around, that I can see, those type of things would be the type of functional limitations that you might want to lay out for your family members. So for instance, I might say that if I have dementia and I cannot meaningfully interact and I can't know who my loved ones are, then I would not want artificial nutrition, hydration, or treatment. Those things would be very helpful to your family members to know. One of the reasons that I think about these as really a gift to our family members is it lets them know what you want, and it prevents conflicts between the family members. And it really does not have to be limited to just life-sustaining treatment. It can really provide a lot of insight into what things would be important, dignity issues, other issues that might be important to you towards the end of your life. Funny story, I had someone who I knew who attended one of these sessions with me, and she came up to me after and she said, you know, it is so wonderful to know that I can tell my sons how important it is for me that I have makeup applied and that they tweeze those little chin hairs that are, you know, bothering to all of us. And it may sound silly, but, you know, that for her was really all about dignity. And so knowing that she could share that information with her loved ones was really important. And you know what? Now you're giving your loved ones, when they have very little control, very little that they can do, something that they can do for you and on your behalf that they know is important to you. So I do encourage you to kind of think about things that are important beyond just, you know, whether I want end-of-life treatment. The document can provide insights into your values and goals and your preferences, as we mentioned. But one of the problems with living wills is that often they're not there when no one knows where they are at the point that they're needed. In an emergency situation, they're not going to be honored because the EMT or the emergency room doctor is not going to take the time to read and understand and have the legal team review these documents. And sometimes they can be unclear and not directly apply to the situation at hand. And that's why the healthcare agent, the designation of the healthcare agent, the healthcare proxy is so important. But it also opens up some other things that you might want to consider, some other documents. So we have specific documents. We have do not resuscitate, as well as a do not intubate or a do not hospitalize orders. And these are specific medical orders which have become part of the medical record. They can be posted in your home and should be posted in your home so that the first responders are going to honor them. So if you were to have a DNR order, then if for whatever reason a first responder does get called, because sometimes family members get flustered, they call 911, but then the medical team would know that they are not to undertake CPR. So those things can be really important to do if it's appropriate and if that's something that you've decided, given your medical situation, you do not want. Another order that can be really important is something that's called a POLST, a provider order on life-sustaining treatment. In some other states, it's called a MOLST, a medical order. And this is an order that you would discuss ahead of time with your physician or your advanced practice nurse based on your own individual medical condition. So for instance, you might have a life-limiting illness, you might have a terminal illness, or something that's just chronic and serious. We'll often find this appropriate for individuals with dementia or even an early cognitive impairment, or just someone who is older, frail, and weak, and is envisioning that having life-sustaining treatment, something like CPR, would not go well for them. We learn that CPR can be very, very traumatic and can result in broken ribs, broken bones, and not a likelihood of recovery. So in consultation with your physician, you might make that decision that you wouldn't want CPR in this particular situation. We also have individuals now in the COVID crisis who are having discussions about whether or not they would want to be placed on a ventilator given their weakness or given their underlying illnesses. And so that might be a situation where a POLST would also be appropriate. What's essential here and really special about these orders is that they become a medical order and part of your medical record. So they follow you whether you're at home, you go into an emergency room, or if you're in a nursing home, a hospital setting, any setting, this order is going to follow you and will be, excuse me, honored by the medical professionals. If you have a healthcare surrogate, they can sign these orders. So it's not just the patient, but it could be anybody who has the legal authority to do that. And the real focus here, one of the reasons that these are very useful is they focus on goals of care. So they can address more situations and more of a gray area than a particular living will might do, because they are informed by your medical condition and they focus on your goals. So for instance, you might have a goal, you might say that I would be willing to be on a ventilator if it was a situation where I was going to recover fully, if the ventilator then worked. But I might say I might not want to be on a ventilator if I were not going to. You might have a trial period that the document specified. Or you might say that you want full treatment for the next month because you are looking forward to a particular event that's happening. But then after that, you might not want that treatment if you have an underlying illness. So it's very specific to your particular situation and can be modified at any time. When we talk about the importance of having a healthcare proxy, and it really is about for all of us, that is something that healthy individuals, all adults, should have in place. If there's one thing we have learned with this illness is that it doesn't matter how young you are, how healthy you are, you can be in a situation where you do need treatment and you do need life-sustaining treatment. But this document, a healthcare proxy, a designation of an agent, is really for anyone, because it can there can be a situation where you have an individual who is unable to speak, and other decisions beyond life-sustaining treatment need to be made. And we find that when patients don't have a surrogate, so they don't have an immediate family member or someone who has the authority to make healthcare decisions, they really are at risk. They're at risk of over-treatment, so the physicians may err on the side of giving them all treatment, or under-treatment. So you'll often find that individuals who are at home and isolated seniors end up not receiving any medical care because no one really is aware of what their needs are and no one's advocating for them. Oftentimes, decisions may be postponed. So again, if there's no one to advocate, we have a situation where that we end up having to wait until there's a crisis, at which point then medical care would be given. We also see that that delay can cause a lot of suffering. So there are statistics about individuals who don't have surrogates, who are what we often refer to as the unbefriended, people who don't have surrogates in place and don't have natural family surrogates. They end up staying in the hospital longer. As a result of that, they have an increased chance of infection and morbidity and mortality. So we really can be life-saving to have an individual designated to make decisions for you, have that individual know what your wishes are. So when we think about this, we really think about this as a quality of life issue. Having a healthcare surrogate, having that person know what your wishes are, and having some important conversations about what your values are can be really empowering. It really gives those family members something that they can control when they feel so out of control, dealing with end of life, and shares what's important to you. So, my family knows that for me, there are certain situations that I would not want to live in, and others that I am okay with. So it's really important to share that information with your family members, as well as to take the time to draft these documents and have them in place and have your family members know where they are so that they can use them when and if the time comes. So I'd like to close with this. You may be familiar that Nancy Cruzan was someone who there was a litigation surrounding what her wishes were. So she was kept on life support for a long period of time. You see here that she was brain dead in 1983, but then was finally let go in 1990. So, we see, I'm sorry, probably not brain dead. She was on life-sustaining treatment in 1983 and then was finally let go when the litigation was resolved in 1990. So you really do have an opportunity now to decide what your wishes are, to have those discussions, and to empower your family members to be able to implement those wishes and make decisions that reflect those, so that you have the dignity of end of life that is what you want, whether that's to have all intervention or to have more limited intervention. So we encourage you to do that. Lisa, do we want to open it back up, see if we have any questions or thoughts?
Sure. I'm just looking on our Facebook page. We have a few people who are viewing, but I don't see any comments or questions just yet. I've referenced a few of them myself. And in the comments section of this post on Facebook, you'll see that I did type in 5wishes.org. I would just also, add to some of the things that Shana shared. And really, this was eye-opening for myself too. Every time I do this, I learn more. And with the 5wishes.org and just looking at having these conversations, what we call conversations of your life around end-of-life planning, this is also the time, besides some of the legal matters and what kind of care you want to receive, to also think about those conversations you should be having with your family about how you'd like to be remembered. You know, what are the things that are important for you? What kind of legacy do you want to live? Are there certain things that have been unsaid between you and relatives maybe that live far away that that you want to make sure that they know before you pass? I would say, you know, we're all kind of sheltered in place right now. This is as good a time as any to just be having those conversations and having them in a loving way or in a humorous way, and to not be shy about them. You know, we all recognize that life is very fragile, and any of us at any time, you know, need to be aware that there's one guarantee in life, and that's that we don't get to live it forever. So having those conversations are really important. How do you want to be remembered? Who do you want to be saying words about you when you pass? You know, right now it's very unfortunate that people can't even be having, you know, funerals except in very small ways. But they're postponing them for later and having memorial services. What are those things that you want people to remember you for? Who are the people that you want to be there? Who would you like to speak for you? What hymns, if you have favorite hymns or songs that that speak to you, that have been your favorites, that maybe you would want to have. I've already shared my list. I filled out a 5 wishes form, and I'm a very musical person. So there are certain hymns and even just secular songs that really speak to my heart. And those are things that I want played at my memorial service. And it feels good to have that power to make those choices in
Yeah.
advance and not leave it to guessing.
No, I would say, Lisa, that some people are finding because of just kind of the anxiety that they're dealing with now, they may find 5 wishes to be a little bit overwhelming, and that's okay. You
Yeah,
don't have to enter every section of 5 wishes.
very true.
You
Yeah.
really can do just the portion where you name an individual, share whatever feelings you do feel comfortable, but you don't have to get into all of that level of specificity if that's overwhelming or too, you know, emotional for you right now. That's okay.
Yes.
Um,
Yes. Yeah.
the other thing I would mention is that, again, we're not just talking about end of life. So many people, fortunately, are hospitalized and are getting better. But we still need to know what they want during that period. So, you know, right now we don't have any visitation. But one of the issues that has come up over and over again is, what if we, in a normal situation, we do allow visitors, but there might be somebody who you don't want to visit. You might have family members who are very religious, but you're not religious, so you don't want to have a clergy member come by your bedside. So things like that are
Yes.
also things that can be shared and could be, you know, really important to make it what you want instead of what, you know, your family member might want.
Exactly. I mean, this is really about empowerment and and
Absolutely.
and feeling like you have, and you know, just knowing that you've communicated to the best of your abilities what your wishes are, and have chosen well. And that's the other part of it, is just like really choose the right person, because sometimes we might think it's, you know, the person that is closest to us. Now, I picked my husband, but that's because I trust him.
Yeah.
But not everybody has a living spouse. Many people
Right.
live by themselves, but they might have 2 or 3 children. And just picking the right adult child to make those decisions for you is really important, because some of them are better equipped to handle it than others.
Absolutely, yes. I've often seen clients who have not chosen the child that they're closest to because they feel that that person will be too emotional, or, you know, isn't a strong advocate, is somebody who's a little bit more passive with healthcare professionals. So I think it is really important to choose someone who you know will be able to advocate for you. Yep.
Yeah, and you know, the thing is, look, that's a big part of it. Look at their skills. What do they bring in terms
Mhm.
of being able to be your advocate? And
Mhm.
don't worry. This is like the one time you should not worry about hurting somebody else's feelings for not choosing them,
Right.
right? So, because it's not about them, this is going to be about you.
Yeah.
And you want to make sure that you do this right. I've seen it as well in families where they pick the wrong person to be that person, to be that advocate, because they felt like that person would be maybe offended or slighted that they weren't picked.
Yeah.
So this is not the time to be worried about stuff like that. Pick well, pick the person who has the skill set that you think will that will enable them to actually carry out your wishes and advocate on your behalf.
And
So
I know a lot of people struggle because they have more than one child or they have more than one person who they want to be able to step in and take this role. But there can be HIPAA releases that are signed for multiple people so that multiple people can stay informed, but
yes.
then having a priority list in terms of decision making so that it's clear to the healthcare professionals that, okay, that person who's listed as number one has first priority, but then if they are unavailable, then the next person can. But yet the physicians and nurses can't speak with anyone who's on that list. So, that can be really helpful and kind of address some of those concerns because everybody's concerned, well, I'm choosing one child over another.
Yes, I'm just looking to see if we have any questions. No, we don't. We don't have any further questions.
Okay.
Yeah, but I actually do have one that was brought up a while ago to me, and that had to do with DNRs.
Mm-hmm.
So now I understand that you had said that you want to have a DNR somewhere in your home. If you have a DNR and you've made it clear that you do not want to be resuscitated, you would want to have that at home to post for first responders. Is that correct?
Yes, typically people will place it on the refrigerator. When we're in facilities, you might see it like over your bed,
Right.
or or at the foot of your bed. Yes.
Now I've been told that so we here in Westwood have volunteer EMS.
Mm-hmm.
So they're not paramedics. There's a difference, obviously.
Right.
And from what I understand, if you are, and correct me if I'm wrong, but if you are a volunteer EMS personnel, you have to resuscitate. The DNR does not apply. They can get them to the hospital, and then they'll take care of them in terms of DNRs. But are you aware of any limitations on that, whether you're professional or paraprofessional?
My understanding, and I'm not 100%, is that there is a mechanism for you to have a DNR that would be respected by all of the professionals, but you have to take some extra steps to be able to, to have that be honored. So,
Okay.
that's something maybe we can share some information online about that and
Yeah.
clarify
Yeah.
that. But
Okay.
yeah, I think that even if you were in a situation where you do have volunteers and you do have this issue, that's where it could be really important to have that communication with your family members so that they don't pick up that phone. And I know it's very, very hard. Even, say even the social worker who works on my team was faced with this situation. And what did they do? She called 911 because it's a response. It's something that you do. Even though ultimately they did decide not to move forward with treatment. So, I know it's easier said than done,
Yeah.
but sometimes it does make sense to not, at least have those conversations to know that it's okay not to call 911 or in what situation it would be appropriate. Because just because you're DNR doesn't mean that, it might not be appropriate for something like pain management. You're in a lot of pain, they need to go to the hospital
Yeah.
in order to get that treatment.
Yes, absolutely. Good, good. Okay, so I want to thank you so much for taking time out of your busy schedule and doing this workshop with us. This has been very helpful information. And we're going, it's now shared on our Facebook page. We are also going to be sharing it on our YouTube channel and on our Westwood for All Ages website. If you have any questions about advanced directive planning or estate planning, feel free to contact Shana as well. And we'll also include that information in our post of how people can reach you. Is that good for you? Does that work for you, Shana?
Yeah, that's terrific. Great.
Okay, wonderful. Thank you. All
Thanks
right.
so much, Lisa.
Thank you very much. And everybody out there, stay safe and stay well until we can see you again in person. Bye-bye.